Welcome to this therapeutics revision quiz on peptic ulcer management. In this video, we'll explore key pharmacotherapy principles and clinical treatment guidelines that form the foundation for the effective, evidence-based management of peptic ulcer disease. After completing these questions, learners will be able to understand pharmacotherapy management, apply appropriate drug selection and dosing regimens, recognize and manage potential adverse effects and drug interactions, and implement effective patient monitoring strategies. This quiz features 10 scenario-based multiple-choice questions designed to test your clinical reasoning skills. Each question includes 5 answer options, followed by the correct answer and a concise explanation. So, let's get right into it. Question 1. Mr. Anderson, a 54-year-old man, presents with epigastric pain and a positive Helicobacter pylori breath test. He is not allergic to any medicines. His past history includes mild hypertension managed with amlodipine, and he is otherwise healthy. Which of the following represents the most appropriate first-line eradication regimen for his condition? Option A, omeprazole, amoxicillin, clarithromycin. Option B, lansoprazole, metronidazole, ciprofloxacin. Option C, pantoprazole, levofloxacin, tinidazole. Option D, rabeprazole, doxycycline, metronidazole. Option E, esomeprazole, amoxicillin, azithromycin. The correct answer is option A, omeprazole, amoxicillin, clarithromycin. The reason is that the standard first-line eradication therapy for Helicobacter pylori in patients without penicillin allergy is a triple regimen consisting of a proton pump inhibitor, amoxicillin, and clarithromycin for 7 to 14 days. Other options either include antibiotics not recommended for first-line therapy or combinations associated with higher resistance rates. According to the British National Formulary, this regimen provides the highest eradication success when clarithromycin resistance is low. Question 2. Mrs. Brown, aged 70, with a history of osteoarthritis, presents with black stools and dizziness. She has been taking naproxen 500 mg twice daily for several months. Endoscopy reveals a bleeding gastric ulcer, and her kidney function is normal. Which drug should be initiated to promote healing and prevent recurrence? Option A, omeprazole. Option B, ranitidine. Option C, misoprostol. Option D, sucralfate. Option E, bismuth subsalicylate. The correct answer is option A, omeprazole. This is because proton pump inhibitors such as omeprazole are the treatment of choice for healing and preventing recurrence of non-steroidal anti-inflammatory drug-induced gastric ulcers. Misoprostol can also prevent ulcers but causes gastrointestinal side effects such as diarrhea and is less well tolerated. Ranitidine and sucralfate are less effective for both healing and long-term prevention compared with proton pump inhibitors. Question 3. Mr. Clark, a 65-year-old man with chronic kidney disease and an estimated glomerular filtration rate of 25 ml per minute per 1.73 square meters, has a confirmed duodenal ulcer due to Helicobacter pylori. He is prescribed clarithromycin, amoxicillin, and omeprazole. 2 weeks later, he reports nausea and a metallic taste. Which component of his regimen is most likely responsible for these symptoms? Option A, amoxicillin. Option B, omeprazole. Option C, clarithromycin. Option D, metronidazole. Option E, sucralfate. The correct answer is option C, clarithromycin. This is because clarithromycin commonly causes gastrointestinal upset, nausea, and a metallic taste due to its effect on taste receptors. Amoxicillin rarely alters taste perception, and omeprazole's side effects are usually mild, such as headache or diarrhea. Therefore, clarithromycin is the most likely culprit, and symptoms typically resolve once the antibiotic course is completed. Question 4. Miss Harris, aged 34, is 16 weeks pregnant and diagnosed with a non-bleeding duodenal ulcer. She has tested negative for Helicobacter pylori infection. Her general practitioner plans to prescribe medication for symptom control. Which option is most appropriate during pregnancy? Option A, omeprazole. Option B, misoprostol. Option C, bismuth subsalicylate. Option D, ranitidine. Option E, sucralfate. The correct answer is option D, ranitidine. This is because ranitidine, a histamine 2 receptor antagonist, has a well-established safety profile in pregnancy and effectively reduces gastric acid secretion. Omeprazole can be used if necessary, but ranitidine is generally preferred for mild to moderate symptoms. Misoprostol is contraindicated in pregnancy as it can induce uterine contractions, and bismuth-containing drugs should be avoided due to potential fetal toxicity. Question 5. Mr. Lewis, aged 58, has type 2 diabetes and hypertension. He was started on omeprazole, amoxicillin, and clarithromycin for Helicobacter pylori eradication. He returns with abdominal pain and mild diarrhea. Stool testing confirms Clostridioides difficile infection. Which component of his regimen is most associated with this complication? Option A, omeprazole. Option B, amoxicillin. Option C, clarithromycin. Option D, metronidazole. Option E, ranitidine. The correct answer is option B, amoxicillin. This occurs due to broad-spectrum antibiotics such as amoxicillin disrupting normal gut flora, allowing overgrowth of Clostridioides difficile. Although proton pump inhibitors may slightly increase risk, antibiotics remain the principal cause. Clarithromycin can also contribute, but amoxicillin has a stronger link with this infection in eradication regimens. Question 6. Mrs. Thompson, a 58-year-old woman, presents to her GP with a 6-month history of heartburn and acid regurgitation that has not improved with over-the-counter antacids. Her doctor decides to start her on a proton pump inhibitor for symptom control. All of the following statements regarding proton pump inhibitors are correct except Option A, they inhibit the hydrogen potassium adenosine triphosphatase enzyme in parietal cells. Option B, they may cause low magnesium levels with prolonged use. Option C, they are contraindicated in pregnancy. Option D, they should be taken before meals for optimal effect. Option E, they can increase the risk of pneumonia in long-term use. The correct answer is option C, they are contraindicated in pregnancy. The explanation is that proton pump inhibitors are generally considered safe for use during pregnancy when clinically indicated, with omeprazole being the best studied. While caution is always advised, they are not formally contraindicated according to the British National Formulary. The other statements correctly describe their mechanism, adverse effects, and optimal timing for administration. Question 7. Mr. Jacks, a 55-year-old man, presents with a history of peptic ulcer disease. He has been advised to make certain lifestyle modifications to help prevent recurrence. All of the following non-pharmacological measures are beneficial in managing peptic ulcers except Option A, avoiding non-steroidal anti-inflammatory drugs and smoking. Option B, reducing alcohol and caffeine intake. Option C, consuming smaller, frequent meals. Option D, increasing dietary fiber intake. Option E, using aspirin regularly for heart protection. The correct answer is option E, using aspirin regularly for heart protection. This is because aspirin, like other non-steroidal anti-inflammatory drugs, can worsen or cause peptic ulcers by damaging the gastric mucosa. Although aspirin may be required for cardiovascular protection, it is not considered a beneficial non-drug measure for ulcer management. The other lifestyle modifications reduce acid irritation and promote mucosal healing. Question 8. Mrs. Johnson, aged 68, is taking clopidogrel after a recent stent insertion. She develops indigestion and is diagnosed with a small gastric ulcer. Her doctor considers starting a proton pump inhibitor but is aware of potential drug interactions. Which proton pump inhibitor should be avoided in this patient? Option A, omeprazole. Option B, pantoprazole. Option C, lansoprazole. Option D, rabeprazole. Option E, esomeprazole. The correct answer is option A, omeprazole. This is because omeprazole inhibits the cytochrome P452C19 enzyme, which is required to activate clopidogrel, thereby reducing its antiplatelet effect. Pantoprazole is preferred as it has minimal interaction with this pathway. Esomeprazole shares a similar interaction risk to omeprazole and should also be used cautiously. Question 9. Mr. Evans, aged 60, presents with recurrent indigestion after Helicobacter pylori eradication therapy. Repeat testing confirms persistent infection, and he reports perfect adherence to treatment. Which regimen is most appropriate for second-line therapy? Option A, lansoprazole, amoxicillin, metronidazole. Option B, omeprazole, amoxicillin, clarithromycin. Option C, pantoprazole, levofloxacin, amoxicillin. Option D, rabeprazole, bismuth, metronidazole, tetracycline. Option E, esomeprazole, azithromycin, tinidazole. The correct answer is option D, rabeprazole, bismuth, metronidazole, tetracycline. The explanation is that quadruple therapy including a proton pump inhibitor, bismuth, metronidazole, and tetracycline is recommended as second-line treatment following clarithromycin-based regimen failure. This combination targets resistant Helicobacter pylori strains more effectively. Repeating the same antibiotics, such as clarithromycin or amoxicillin alone, risks further resistance and treatment failure. Question 10. Mary, a 42-year-old woman with a history of peptic ulcer disease, has been prescribed misoprostol to prevent gastric ulcers while taking NSAIDs for chronic arthritis. After a few weeks of therapy, she reports experiencing some side effects. All of the following are adverse effects associated with misoprostol therapy except Option A, diarrhea. Option B, uterine contractions. Option C, hypokalemia. Option D, abdominal cramping. Option E, contraindication in pregnancy. The correct answer is option C, hypokalemia. The explanation is that misoprostol, a prostaglandin E1 analog, primarily causes gastrointestinal side effects such as diarrhea and abdominal pain and is contraindicated during pregnancy due to its uterotonic effects. It does not affect serum potassium levels. Therefore, hypokalemia is not an adverse effect associated with misoprostol therapy. Conclusion. That wraps up our revision on peptic ulcer management in therapeutics. I hope this quiz has helped reinforce your understanding of key clinical decisions and pharmacological principles used in everyday practice. For those who want to deepen their knowledge, I highly recommend reading Clinical Pharmacy and Therapeutics by Kate Whittlesey and Karen Hodson, Clinical Pharmacology and Therapeutics by Ritter, Lewis, and Mant, and of course, the British National Formulary, BNF. All the recommendations discussed in this video are aligned with current guidance from the BNF to ensure clinical accuracy and relevance. Keep learning, stay curious, and don't forget to subscribe for more therapeutics revision content to help you stay ahead in your studies and professional practice.